Live.
Good afternoon and welcome to the COVID313 Coalition for Families and Students. My name is Jametta Lilly and I am a proud member of this very special coalition, and I'm blessed to serve as the CEO of the Detroit Parent Network. But before we get started, we want to make sure that we hear from you and your comments or questions that are on Facebook. But a couple things that we'd like to know and chat us back. So where are you joining us from? And how did you hear about the town hall today? What topic are you most looking forward to hearing about today, particularly because we have special guests from the Wayne Intermediate School District and one of our prominent federally qualified health clinics. So what are your questions? And tell us, what are you celebrating today? What are you celebrating about being on this planet Earth today? So let us know, chat us, hit us on Facebook, hit us in the chat as part of Zoom. As always, we are translating this town hall to Spanish and ASL. So we want to give folks a little time to get comfortable before we start. And as we get ready to start, let's have Ophelia. Ophelia, if you would please give us the details on how to connect for Spanish translation.
Yes, good morning. Buenos días. Thank you, Jametta. Si quieren ver este video en español, en el chat vamos a poner el enlace donde pueden verlo en español, o también pueden ir a la página de Detroit Hispanic Development Corporation en nuestro Facebook. Estamos transmitiendo en vivo. Muchas gracias.
Thank you, gracias. And also we want to have our ASL interpreter. Julie, would you share that information with us, please? Thank you, Julie, and thank you, Ophelia, as always. So audience, we have some really important experts today, but to our experts, please remember to speak slowly for our translators. We want to make sure that they are translating this important information and that they are sharing correctly. Experts, if you would, when you join us, turn off your camera when you are not speaking. And be aware that if you are going over your time a little bit, we have Terry Whitfield, who is our awesome timekeeper. And Terry will chat you what your remaining time is. And if you go over a little bit, either Rajeshri or I will probably come on screen and nudge you to please go ahead and wrap up. Well, so much for the logistics. So let's get ready to get into this morning's program. So today we have some important topics as we try to bring you every single week, and we have been doing so since the middle of March in the start of this pandemic. So today we'll be covering updates from the Wayne County Superintendent, the new superintendent for the Wayne Intermediate School District, Dr. David Colbert. And she'll be sharing information with us about her vision as the new superintendent for Wayne County, and also back to school, what should we be expecting, and what are the new learning opportunities that districts may be providing. And so important, what are we needing to know as we think about COVID and masks and the various guidance around health and mitigating COVID. And to continue this conversation, not only from the educational perspective, we're always so pleased to be able to welcome back Dr. Valbuena. Dr. Valbuena is with the Chaz Clinic and will be sharing updates with us so important that have to do with COVID and what we are seeing with the increasing viruses and also, unfortunately, the new variations of the virus. I'm going to pivot just for a moment because when I look at the screen, it looks like we're going to make a few adjustments in our program a bit. So I want to pivot for just a quick moment to Rajeshri, because I know we're going to not only want to hear from Dr. Valbuena, we're also going to have the opportunity to hear from the Detroit Health Department, which is a really important part of our work consistently. And so while we're waiting for Dr. Colbert to join us, Rajeshri, I'm thinking Dr. Valbuena is an awesome doctor with lots of patients he needs to see. Shall we go ahead and ask Dr. Valbuena if he'd like to start us off?
Absolutely.
Right.
Absolutely. Thank you so much. Welcome, Dr. Valbuena. We're happy to have you here again today.
Thank you.
So let's jump into this a little bit. Can you talk to us a little bit about, from your perspective, what are you seeing in the community? How impactful is the virus? Kind of what are you seeing?
Great to be with you today. Glad to be able to share a little bit about what's going on, primarily locally, but we're seeing statewide and throughout the country. This Delta variant is really starting to push forward, infect a significant number of individuals, including individuals who have been vaccinated. So I know that early on in the vaccine efforts, we were all given an incentive. Get your vaccine, you don't have to wear a mask anymore. Well, that was before the Delta variant. And we know that the Delta variant is 2 to 3 times more contagious than the previous variants or the original COVID-19. And so what happens is individuals who are vaccinated now can actually get the infection, and we carry it in large quantities in our nasal passages. And so as we're breathing and talking, we are transmitting it to anybody around us. And individuals that aren't vaccinated, whether they can't because they're under the age of 12, or individuals that could but have chosen not to get vaccinated, are now at a significantly higher risk of contracting the virus and ending up in the hospital with significant consequences of the virus. Doesn't mean that the vaccines are not working. The vaccines, even though fully vaccinated individuals can get what we call a breakthrough infection, we're seeing that the number of individuals that are having negative consequences are still significantly lower than individuals who have not been vaccinated and are exposed to the virus. But the challenge, 2 added challenges that we have along with this now is that kids are going back to school, and kids that are 11 or younger can't get the vaccine. The other challenge is that we're getting into the fall when it gets colder in at least in our area, and we're going to be spending more time indoors. We're going to see influenza coming as that season comes, and we're going to see a significantly larger number of individuals contracting the virus. So the challenge that we have now is continued vaccination, because the more individuals we can get vaccinated, the less the chance of spread to individuals that are going to have negative consequences of contracting the virus. There's been a challenge also with not vaccine mandates, with mask mandates in the schools and businesses, and the state hasn't come out officially to say, to mandate the masks. And I know some of the school districts are having challenges with that. Some are mandating it, and the parents aren't happy about it, and some aren't are not mandating it, and the parents are unhappy, depending on where what school district your children go to. So it's going to continue to be a challenge. The recommendation is that everybody wear a mask, whether you're vaccinated or not, when you're going to be in an enclosed area with individuals that you don't know their vaccine status, or that they cannot be vaccinated because of age. And hopefully we'll have vaccines approved in the next few months for the 5 to 11-year-olds, which will help us some. But influenza is going to be an added challenge, and the fact that we're going to be spending some more time indoors and the kids going back to school. So we still have a significant way to go, even though we've made significant strides throughout this year. And at CHAS, we continue to vaccinate everybody that is willing to take the vaccine 12 years of age and older with the Pfizer and the Moderna vaccines. And we've found that having a one-on-one conversation with individuals to really address their specific concerns and questions has helped the most to get individuals over that hump to say, okay, I'm ready. And then having the vaccine on demand. So you don't have to make an appointment. We ask that you make an appointment just for staffing purposes, but you do not have to make an appointment to get a vaccine. We're vaccinating 6 days a week, Monday through Saturday. And if the center's open, you can just walk right in. You do not have to be a CHAS patient, a Henry Ford patient. You don't even have to be from the Metro Detroit area or Michigan. We vaccinated individuals who received their first dose outside of the country even that were documented, and we have the same vaccine. We gave them their second dose. So bottom line is, recommendation is to mask when you're going to be indoors. Talk with family members, colleagues, neighbors, and really push the importance of getting vaccinated for those that are not and can. And we look forward to the flu vaccine coming in the next few weeks that we're going to recommend everybody get. And hopefully we'll get the ones for the kids, the 5 to 11, the COVID-19 vaccine, to be able to vaccinate them before we get some variants that the vaccines may not work against.
Right. I think that's so important, Dr. Balbuena. You said some really key things. I just want to make sure we reiterate it.
Okay.
That this variant is 2 to 3 times more or stronger, I guess, for lack of a better term, than the original, which is why those folks who are vaccinated are still actually getting affected, because the vaccine, it's protecting them to the degree it can, but this is a much stronger variant.
Correct.
And the ones at risk are really the ones who are unvaccinated. I can tell you, I recently had an exposure myself, and, luckily had no symptoms and actually ended up being negative after some, getting tested. But it really was important to me to sort of wear the mask and ensure that I, in the period of time where I didn't know what my status was, to really make sure I was protecting the folks around me. Because as you said, you don't know who's not vaccinated. And we know for certain children under a certain age are not, and happen to have a lot of those around me. So I think it's important for folks to realize that just because you're vaccinated doesn't mean that you won't get it. It is likely to be less impactful, but that you are equally capable of sharing it with those who are unvaccinated. So it's really important that we remember the children in particular around us and those who are unable to get vaccinated. Great to hear that your organization is going to continue to support and vaccinate pretty much anyone who walks through your doors.
Anybody.
Can you talk to us a little bit about boosters, right? We've been hearing about boosters in the news. Who needs them? When do we need them? How do we get them? Is it time now? Help us with that a bit.
So regarding the COVID-19 vaccine boosters, the evidence, that the data that has been gathered with the millions of individuals that have been vaccinated is that approximately 6 to 7 months after the completion of the series, we're seeing a slight decrease in the immune system response to the virus. And for those individuals that are immunosuppressed, so those are individuals that their immune system for one reason or another is decreased. So for example, people who have organ transplants, they take a medication to keep their immune system a little bit in check so that their bodies don't reject the transplant. People who are have cancer and are undergoing active cancer treatment, their immune system will be decreased a little bit also. And so those individuals those are just a few examples, individuals that are, we say, immunocompromised or immunosuppressed, the booster is recommended now, because as we've seen that effect of the vaccines drop slightly, not significantly, but slightly, we know that those that their immune system isn't working as well, they didn't create as much defense against the virus from the beginning when they got their vaccines. So the individuals, and you can check with your primary care doc to verify that you're in that group that's currently recommended that they get a booster, and we can start doing those boosters of the same vaccine that you got when you got the first two. So that's only for Pfizer and Moderna. Currently not recommended for the Johnson & Johnson vaccine, because that one was approved a little bit later, and we're waiting for the time period of data gathering to see the effect, what's happening at 6 to 7 months after that one it has started. And then for everybody everybody else in that group that's not immunosuppressed or immunocompromised, the recommendation is 8 months after you received your second dose. And for most, that's not going to come till middle to end of September. If you look at when they would have gotten their second dose, because most people that got them early, the first responders, the elderly, they started last week of December, first week of January, and you have to wait, 3 weeks or 4 weeks to get that second dose. And then from there, you would count the 8 months. So the official start date for everybody else isn't out yet, but that is being worked through so that by hopefully the next week or two, beginning of September, they'll be able to give us a date when individuals are recommended to get their booster dose. And we will be able to do those here. The dose is exactly the same as you got. So the first dose, the second dose, and the booster dose, regardless of whether it's Moderna or Pfizer, are all identical. It's not a higher dose or a lower dose or a different formulation. It's the exact same.
That's what you got
vaccine.
before.
Just call the booster dose. And
So,
that's-
Dr. Balbuena, we got a question from the audience. Normally we save them till the end, but because it's so timely, I'm just gonna ask it to you now. Somebody asking, do diabetics need to get a booster specifically, and what should they expect?
Yeah, the diabetics right at this moment wouldn't need it because they're not in that immunosuppressed unless they're taking prednisone for some specific reason, but it wouldn't be for diabetes because prednisone actually brings your sugars up. So the diabetic patient currently does not need that booster. They will be in the group with everybody else when the 8 months after that second dose recommendation comes out.
Great, thank you, that's helpful. And I'm assuming that the booster shot will be the same as your original shot. So i.e. if you got a Pfizer dose, your second dose, your first 2 doses for Pfizer, your booster will be Pfizer. If your first 2 doses were Moderna, your booster would be Moderna.
Currently for the immunosuppressed, yes. For the others that are going to start mid-September, that's part of the reason why they still haven't officially announced, because they're trying to look at the data to see if you're able to swap one or the other. But currently the recommendation is your booster dose will be the exact same as your first 2 doses.
Okay.
Yep.
Okay, great. Sounds like there's going to need to be a lot of communication.
Yes, and I'll be glad to come back on as soon as that information comes out. We can try and coordinate that, and I'll help to update everybody on that.
Great, appreciate it. All right, so switching gears a little bit, we talked a little bit about the young folks, and we're about to get into back to school season. So it's always helpful for parents, for all of us who are parents, to hear reassuring words from physicians like yourself about what can we expect, how do we keep our kids safe, and how do we keep them safe at school and in the community, because none of us want to go back to lockdown. So can you share a little bit to help all of us understand what we can do to keep our kids safe?
Yeah, at this point, if they're 12 years or older, get vaccinated. If they're younger than 12 or older than 12 and vaccinated, wear your mask. So everybody should be wearing a mask when we're indoors. We know that is a significantly decreased risk of transmission when you're wearing the mask. And those that can get vaccinated. And we got our fingers crossed that the 5 to 11 vaccine will be approved shortly. And the Pfizer vaccine on Monday received the full authorization, which is just means that a little bit more time has passed with a little bit more data to go from that emergency use authorization to the full authorization. But that was one of the questions and one of the reasons why individuals weren't getting vaccinated. So we're hoping that within the next week or so, we're going to see a little bit of an uptick to get those individuals that were waiting for that full authorization, because we do have the Pfizer. But so the answer to your question is, indoors, everybody should be wearing a mask for right now. And those that are eligible for vaccine, get them as soon as you can.
Great. That's wonderful advice and very reassuring. Can you talk a little bit about the risk of myocarditis and other risks from the vaccine?
Yeah, so we've seen an increased risk, and I want to say it's more from Moderna than with Pfizer, of inflammation of the actual heart muscle, and that's that myocarditis. In almost all cases, it's been easily managed, very short duration, but any case of any side effect that comes up with basically anything that we do in medicine, but with these vaccines, those are being documented. So we have to report if we have any significant side effects. Everybody who's administering the vaccine has a reporting system, and actually the community at large, I think through the CDC, also has a way to report major side effects, so that they continue to analyze. That's what happened with the Johnson & Johnson for a short period of time with the women that were having those clots. And they studied the results, made a decision that as long as we're communicating that there's a little bit of increased risk of that it was okay to start the Johnson & Johnson again. So that myocarditis is being seen mainly in the younger age groups, mainly with the Moderna vaccine, but again is very, for the most part, short-lived and definitely does not outweigh saying I'm not going to get the vaccine because I can get this inflammation of the heart that will go away, because of the significant risk of much worse outcomes if you get the COVID-19 virus, and especially the Delta variant right now, and end up hospitalized or worse.
Yeah, that's the hardest part, right? That the risk of the vaccine is so high that any other risks, while they may be, it's hard to gauge, right? We're comparing it to something that the risk is so high.
Yeah, I always try and reiterate to everybody as we're talking about medicine in general, everything we do in medicine, whether it's a prescription for your cholesterol, whether it's a COVID vaccine, whether it's a test for your heart or a test for your liver, or anything that we do in medicine always has benefits and risks. And we always want the benefits to be as high as possible, the risks as low as possible. As those start to balance out or the risks are higher, we don't recommend the test. We don't recommend the procedure. And we've seen over time, with the evidence, the viewpoint from a medical standpoint change. But right now, the overwhelming evidence of the benefits of being vaccinated far outweigh the risk of just not getting vaccinated and rolling the dice to see if you're going to get the virus. Because if you do get the virus, we know that if you're not vaccinated, your risks of poor outcomes are extremely, extremely high.
And when you think about the folks, like, and I don't know if you have a specific answer, but just on an average basis, how many people, what percentage of folks who get the vaccine actually have any of these side effects or anything that's, is it more than 50%? Is it a small percentage?
It's small. Most people, I would say maybe 50% of people will experience something, and that could be just a little bit of redness, a little bit of itching, a little bit of warmth, maybe a little bit of achiness. But we do know that those side effects, if you do get them, are 24 to 36 hours. So a day and a half, 2 days, you take a little bit of Tylenol or a little bit of Advil, take an allergy medication if it's, itching and red and warm, and it gets better. And those minor side effects are much less significant than getting the virus and getting hospitalized and those bad outcomes that we've seen.
So in terms of side effects, there might be a little bit here and there, nothing that lasts. In terms of these other potential risks, very, very low percentage.
Yes.
Which is, that's again, helpful to know. Sometimes we get things magnified.
Right.
A couple of questions, a couple of questions from our audience here. Sure. What would happen if you don't get the booster?
What happens if you don't get the booster is that your immune system response to the virus will continue to decrease. It's a slow decrease, but will continue to decrease to a point that then you become more susceptible to catching the Delta variant, which is the most common one now, or subsequent variants that I know we're going to start seeing in those individuals as it transmits with individuals that are not vaccinated yet.
Okay. And then just remind us again, for those folks that are still, they're starting the vaccination process. Once you get your first dose, how long do you need to wait to get your second dose?
So if you get a Pfizer vaccine dose, it would be 3 weeks, 21 days right after you got that first dose. If you get the Moderna vaccine, then it would be 4 weeks or 28 days after that first dose. So it's a week of difference. They use the same technology, but that was the indications and the procedure that was created by each one of those companies that made the vaccines.
Great. And in our last minute here, Doctor, you're a community leader, you're somebody that people trust. And there are still a number of folks that aren't fully confident in some of the information that we get. There's some folks who kind of look and say, if I get the shot, I might have problems if I don't get the shot. Is the government doing this for other reasons? I mean, there's just distrust, and it's understandable. This has been a very emotional, difficult time. As a community leader, can you just, as our parting words here in this last minute, offer some words, some inspirational words, and help alleviate some of the concerns that folks have in terms of having trust in this system?
Yeah, so I can tell you that trust is difficult in a lot of situations, but I can tell you that with every single day that passes of individuals having been vaccinated and the researchers, the academic community collecting data from all over the world on the vaccines, on the virus, on side effects of the vaccine, outcomes of the virus, with all the data that's being gathered, as each day goes by, we get more and more and more evidence that says these vaccines are overwhelmingly good in doing what it is that they need to do, and is to keep us out of the hospital and keep us from dying. We've eradicated pretty much 14 different illnesses by doing vaccines. Those are the vaccines our kids all get when they're little, the MMR, the DTaP, all of these vaccines, the polio, these are all illnesses that were identified, that vaccines were created, that were mandated here in the States, and they're practically non-existent. Those illnesses, we rarely see them. And so this is another illness now that is among us that we see causes significant damage. The millions of people that have died across the world from this vaccine, the millions of people who've gotten it, and all the negative outcomes, we now have a evidence-based, documented way to combat it so we can eradicate it. We just need to get it into people's arms. And we're open. We know now that the best way to get those individuals that are still having doubts is to have one-on-one conversations. I've had more than 20 one-on-one conversations, 15, 20 minutes, 30 minutes with individuals that are still on the fence. And they may not be our patients, but if they come in and they have questions and we can get them to feel secure with the responses so that they can make an informed decision and get the vaccine, that's what we want.
Thank you so much, Dr. Valbuena. We appreciate your contributions and your being here, and you're helping to instill trust in our community. We'll see you again soon.
Thank you so much.
I'm going to pass it back to my co-partner in crime here, Jametta. Jametta, go take it away.
Yes, thank you. And again, just really want to thank you, Dr. Valbuena. You have made two, I think, really critical points. One was the importance for us to understand science and that how we have benefited historically from this. And the other piece is that we know that there's still people who have questions. So rather than be negative around those questions, let's in one-on-one and small group conversations answer those and help them hopefully alleviate concerns and fears that they have. And that's why we know that education is so important. And the other reason why we're so delighted to bring, again, one of our new leaders, but not new to the area, but in the title, that is Dr. Davida Colbert, who is the new superintendent for Wayne County RISA, the intermediate school district for Wayne County. Welcome, Dr. Colbert.
Good afternoon, and thank you for having me.
We're delighted to have you, and we know that this time of the year in particular, and with COVID, this is a really difficult time, so thank you for making the time. So if I may, I'd just love to jump in and ask you, as the new superintendent, is there a vision or some things from your perspective that you're wanting the community to know about your leadership and how the intermediate school district is trying to make a difference in the education and health and wellness of our children?
Absolutely. So let me first open up by saying that it is important that individuals even understand what an intermediate school district is. So they were, created by the legislator, back in the 1960s. I want to say it was 1962. And Wayne RESA happens to be one of 56 ISDs in the state of Michigan. Wayne Regional Educational Service Agency, which is what RESA stands for, is in fact the largest, of course, ISD in the state of Michigan, representing more than 270,000 students. Wayne County itself, Wayne RESA services more than 33 school districts and 100 plus public school academies. We also provide service to community-based organizations, our CBOs, that actually service and provide learning to our early childhood division in terms of hosting Great Start Readiness. So as everybody is aware of the GSRP program, which is Great Start Readiness program for eligible 4-year-olds, that's where our community-based organizations come into play, and that could be faith-based, nonprofit, et cetera. And so we are very excited about all of those local entities that I've just outlined, LEAs, PSAs, and CBOs, and providing, consolidated support and services and training teachers in the latest research-based methods and piloting innovative programs and coordinating, again, early childhood, special education, vocational education, even coordinating in some cases business and finance, payroll departments, et cetera. So the reality is that the intermediate school district, in many cases, people see it as a liaison in between the Michigan Department of Education, so the state departments, and the local, the LEA, the PSA, the CBO. So what we do is we try to streamline services, we provide the assistance and support. We stay as a mediator, to ensure that everyone has the information in a timely manner. We navigate the landscape right now in tight communication with the Wayne County Health Department, have been in communication with the Michigan Department of Health and Human Services. And in some cases, we are very, very often in communication with the governor's office and legislators. So that's what you get from the intermediate school district.
Yeah, and thank you for that overview. There are many people who don't understand the educational structure. And one of the things that's so important about our COVID313 coalition is not only do we focus in on education, health, and basic needs, we also focus in on social justice. And we want our parents to be informed and to be engaged. And in order to be good partners for change around education, we got to know that structure, that system. So thank you for breaking that down for us. One of the things we just pivoted out of a discussion with Dr. Valbuena. Yeah. And so I know that you are having many nights, mornings, all the time, and you and educators everywhere. When I think about the charters, Dr. Vitti and Dr. Rice, how right now are you positioning your guidance for the districts around particularly this increase in the more powerful variant? Talk to us a little bit about what that's looking like.
Absolutely. So I will reiterate having numerous conversations, even in the most recent days, and I can be very honest, even a conversation just this morning at 8:30 this morning with the Wayne County Health Department. I can share with you that this has been, a very intense last 2 weeks.
Yeah.
Not because we don't want. Well, let me say this. There's mask and no mask. Mm-hmm. But as I share with people, there's no conversation for that. What we must have a conversation around is health and safety.
Yes.
And then after we move from health and safety, then we move to what is the best strategy to keep our schools open for in-person instruction. Sure, we have a virtual instruction there was the magnitude of virtual instruction even as early as last year, where almost every school district had some variation of virtual instruction. But virtual instruction does not work well for all students.
Right.
So there's not a one size fits all. Some students need more intense, hands-on, in-person instruction regularly. So with that being said, we definitely would like to start the 21-22 school year off with all schools open in person. And that is the goal, and that's what they're all working toward. In order for us to remain open, and especially after listening to the doctor who just shared, again, very, very grim information, that the Delta variant is really dominant, and it is definitely something that we need to be very cautious about. With that being said, all schools must have the most effective mitigation measures and strategies in place in hopes of remaining open without often interruption and or pauses in instruction because of outbreaks. We also know that children under the age of 12 cannot be vaccinated. Right. They do not qualify. With that being said, the unvaccinated are more likely to have this transmission, although we know that there have been many breakthrough cases with those that are vaccinated. With that being said, we want to protect all. That means the unvaccinated and the vaccinated. That then negates the conversation of mask, no mask. We have received, if you look at the CDC guidance, the Michigan Department of Health and Human Services guidance, as well as the Wayne County Health Advisory that came out last week, they all point to schools should enforce universal masking. I will tell you that from the vantage point of Wayne Regional Educational Service Agency, Wayne RESA, we in fact have in our own offices implemented a universal masking policy as of last week. We have encouraged all of our superintendents and school leaders that they really need to consider mask universal policies and or for sure strongly and highly recommending and encouraging. Mask optional is not an option. That's not for health and safety. Yeah. So what we're doing is definitely encouraging. And what I will say, and I don't want to get ahead of the health department, we do believe, and we are certain that some additional guidance will be coming out tomorrow from the Wayne County Health Department that will speak to what I just spoke to. Again, I don't want to release their information on this call, but I can tell you that Wayne County is going to step up and masks will be part of that.
And that's really good to hear because, you know, we've seen leadership in some other counties and with us being the most populous, not to mention that we have such a low vaccination rate, our community is at risk. Correct. So we need the mitigation measures to be significant and for us to continually do that. So thank you for mentioning that. In fact, you've been working with the Wayne County Health Department, correct, the state, and following CDC guidelines. Could you, has RESA sent out any guidance specifically around testing and quarantining in the event, well, first testing and then notification to any of your schools? Is that a mandate or is that? And
I will say that we, in fact, what we do is we share the information from the health department, from the MDHHS, from the CDC. Wayne RESA does not write guidance on health mandates. What we do is make sure that we communicate it well. So we have definitely connected the dots for our locals for regular testing if they choose to do that. We also coordinated the vaccination sites and protocols along with the Wayne County Health Department. What we did is made sure that schools were connected and knew when their turn was to actually go and receive the vaccination. It appears that we will be doing the same when the booster is available for our, staff and even those schools. We've coordinated where there are vaccination clinics inside of different districts. Again, that information does not come from us, but we stay as a liaison in between. So we make sure that schools have all of the information that they need in front of them, and we make connections and connect dots where there are gaps to ensure that when athletes were being tested before they could play, we actually had the testing kits. We made sure that the schools could pick them up. Again, we serve as a major liaison for the county to ensure that schools have all of the information.
So thank you for mentioning that. So we want to say to our parents and families that you be clear that when you speak to your district and you speak to your schools, you're asking them, are you implementing the recommendations that have come from the state and that are coming from the Wayne County for that? So I know that you have to jump to the gazillion things, or I like to always say the 72,000 other things that you need to do. But before doing so, are there some special programs or expanded programming that's occurred, particularly as a result of the Biden's release of millions of dollars in education? Anything exciting in particular you want to share with us?
Absolutely. Well, I'm going to share a couple things. And like you said, I just appreciate you all allowing me to have some time to speak. What I'll say is that, number one, we want all parents to remain as partners. That's number one.
Number one, absolutely.
Family is key. The partnership between family and schools is paramount to success. Parents are partners. We are not here to replace parents. We are here to partner with parents. It takes a village. The village includes all of us. So number one, let's continue to make sure that we work together for the good of all of our children and youth. They need all of us. I also want to lift and make sure that everybody recognizes that zip code does not determine destination. I say that
singing our song, aren't you? We're in the same choir, all of us.
I say that because I want every student, every child and family, every parent, every family deserves a high quality educational opportunity, a high quality learning experience. So I say that, and I say that with conviction. There's opportunity out here, and we need to ensure that that is taking place and that we are embracing it. The dollars that are coming to school districts as of this school year, which I will say thank you to our legislators for making sure, and all of our elected officials for making sure that there was an investment in education in the state of Michigan. But there have been some dollars that have been allocated in ways that really connect to stopping generational poverty, for moving the needle. That includes dollars that have been allocated for our early childhood division, which includes the Great Start Readiness Program, which means that every eligible 4-year-old should be connected to a research-based, high-quality learning opportunity. Prior to the school aid budget's investment, there were about 22,000 students across the state who were not connected to the opportunity of early childhood because the investment had not been there. Well, with the investment this year, and it appears that this investment will be ongoing. So we really want to make sure that families understand, we want to change the narrative. School is mandatory at the age of 6, first grade. School is mandatory at the age of 6, first grade. But schooling should start prior to the age of 6. Kindergarten, it's age 5. All children should be connected to kindergarten opportunities and experiences. But yet there's an opportunity for 4-year-olds that we want to move the needle to absolutely acknowledge that 4 years old is where we want to start engaging, and even as early as 3 years old. So you will hear more about a pilot program that's out right now in some of our communities, very few classrooms. So there's only 4 classrooms in Wayne County, but you're going to hear me continue to talk about this, called Strong Beginnings. Strong Beginnings, that's for 3-year-olds. But then you're going to hear this push from Wayne County to talk about Great Start Readiness for 4-year-olds. So last year throughout Wayne County, we absolutely connected about 7,300 4-year-olds to Great Start Readiness. We would hope that at the end of this year, we will have connected more than 12,000 students to Great Start Readiness throughout the county. That means there is a huge push in the city of Detroit for Detroit expansion, where hundreds of classrooms, hundreds of seats have already been opened up. And so we're excited about that. There's an investment throughout the county. We have neighboring school districts that are doing the same with opening up these classrooms. The reality is children who are connected to Great Start Readiness programs, children who are connected to high quality preschool learning have better life outcomes. We see it in 3rd grade. They have higher scores. They are more likely to read on time at grade level. You know, the read by grade 3 law is in place. We want to make sure that all children are reading. First of all, we want them kindergarten ready, 1st grade ready, 2nd grade ready, and then 3rd grade ready. And we do not want them to even be considered as not scoring appropriately, not proficient, where they would be considered for the read by grade 3 law to be retained. Right. So that's why it's so important for us to change the narrative, for us to continue to educate parents around this opportunity, to ensure that I know grandma is lovely and grandma will keep our 4-year-old, but we want to connect that 4-year-old to this research-based programming. We know some families that the 4-year-old is at the neighbor's house. We know that some of them are at child care centers that don't have the academic focus, but they're wonderful child care centers. What we want to do is ensure that all of our 4-year-olds have an amazing, great start. The phone number to connect families is 1-833-368-7932. Again, it's 1-833-368-7932. And really people say it's 1-833-4-year-old, 4-year, YEA. Yeah. And that will connect it. So, and you can always reach out to Wayne Reese and just say, I need help. We have a roster on our website that connects all of our programs that are open, and we're updating that roster every day because we're opening new programs every day. The narrative is education is key to success. It is foundational. Again, if we want to stop or even put a pause into generational poverty, education is the foundation in how we do that.
Quality, so let's continue. Equitable education. Absolutely. Dr. Colbert, we have one question, if you could hold tight for that. So thank you for lifting up the issue of equity and quality. They're essential for all children. Rajeshri, a question.
Absolutely. So I've got two in the last 30 seconds that we have here left. What do you know? What are the chances and what do you know about districts in Wayne County school districts in Wayne County mandating employees be fully vaccinated?
So I will say that is something that we are not having vast conversations about in terms of mandating vaccinations. Remember, there are some individuals who cannot be vaccinated, and I'll leave it there. But I cannot share with you that I know of 1 or 33 districts that are mandating full vaccination. I can say what I do know is that each and every school district and public school academy definitely encouraged. Some of them actually held their own clinics. And I know that when we were coordinating for teachers and staff to go and actually participate in the vaccination and become vaccinated, that all schools and districts were on board. So I can say that it is strongly encouraged for individuals, all staff, to be fully vaccinated, strongly encouraged. And many of them, I can say, are up in the 70% only because some of them have shared that.
Got it. That's really helpful. Thank you so much. And the last question, I think if I heard you correctly, I'm going to ask it, but I think you might have answered it before. Any idea if and when Wayne County will mandate masks?
Stay tuned till tomorrow.
Gotcha. That's what I thought you said, but I thought it bear repeating. Right?
Stay tuned till tomorrow, and you didn't hear that from me, and I know that this is streaming live. What I will tell you is that stay tuned.
Mm-hmm. Thank you.
And I want people to please brace themselves. No one's mandating because they just want government authority to tell people to turn left or turn right. Mm-hmm. In the event that you see a mandate tomorrow, it is because the goal is to keep schools, first of all, as healthy and as safe a place and environment as it can be. And second, to ensure that we can have learning in person throughout the year with minimal interruptions and pauses. And as the doctor said prior to me, well, I'm not going to say that. Let me just say this. If you look at what's out around quarantine, if in fact we do not have universal masking in schools, and if you look at the data that was released by the Michigan Department of Health and Human Services just last week, and if you heard what Dr. Caldoun said, and even if you look at what has happened in other states that have opened prior to us, as well as, I'll give you a district because it's public knowledge, look at what has happened at Heartland, which is in Cadillac, which is in Michigan, that has opened prior to us, where you have 100 plus students that are being quarantined. If in fact you don't have these mitigation measures, the best, the most in place, then you will have students that will possibly have to quarantine, where had you had the mitigation measure of the masking, fewer students would have to quarantine unless they were showing signs and symptoms. Again, in school, in person, getting quality learning versus at home because I have to quarantine because mitigation strategies weren't in place could shift what learning looks like for this entire year. And that is not a positive outcome for our young people.
That is so true. Masks today, keep schools open tomorrow, right? It's kind of what we're hearing. Right. Thank you.
Dr. Colbert, thank you so much for setting aside the time. We would love to have more conversation. And we know that the atmosphere, the reality of COVID is changing, and we appreciate all of our leaders being agile and being transparent as we all try to work to stop COVID and to make sure that all of our children can thrive. Thank you so much.
I appreciate you all. Let's continue to work together. Again, as you all know, the village is important. And we are definitely going to continue to push our young people to reach their full potential. Let's all rally behind them to see them to success.
Thank you. Rajeshri, I'm going to pass it to you because what better way for us to keep talking about our village, and so the components of our village to help keep us safe. Passing that to you. Thank you so much.
Thank you. It's my pleasure to welcome Nurse Hackney from the Detroit Health Department. So I'll just wait for her to turn on her camera and join us to answer a few questions and share her information.
Hello, hello.
How you doing?
Good, how are you all?
Wonderful. Great to see you. So I understand we have a few slides, so I'm going to go ahead and we'll start with those, and we'll do that for a few minutes, and then we'll go ahead and we've got some questions for you as well. So why don't you take about 2 or 3 minutes, 4 minutes to go through your slides, and then we'll be back and here for some questions.
Awesome. Thank you. Again, thank you for allowing us to be here from the Detroit Health Department. A lot of this information has already been given, but of course, we always like to start off with some data. So as we go through our numbers, the current situation for Detroit, as of August the 23rd, we're still looking at over 53,000 confirmed cases. We look on the right side of the screen, the percentages here are low as far as the positivity rates for COVID, but they're going high and they're fluctuating. Again, we're just going to keep reiterating from the City of Detroit Health Department. Yes, we have variances out here, the Delta and the one that's right under Delta, which is over 86.4% of all positive cases. To remember, wear your mask. Just to keep social distancing, it's important for us to remember this, because if we look at our next screen here, only 42% of Detroit is vaccinated. Macomb, Oakland.
I'm just going to interrupt you real quick. I don't think we have your slides. So, so you're referring to stuff that we can't see. I don't know if you want to show them or if you want to.
Oh, yes, definitely. I'm so sorry. I thought I shared the screen. Let's go back. Oh. So
there we go. Much better. Thank you.
No problem. Thank you. So again, going back to the numbers, 5.8% of Detroit is positive right now, which these numbers are low. We want to stay there, and just to keep, as a City of Department of Health, to keep these numbers low, to wear masks inside places, keep using social distancing. Again, be safe. Keep washing your hands. Yeah, we're getting ready to go back to school, but it's important to remember, and some of us are getting ready to go inside to go to work. It's important to remember, as those that spoke before me, and you guys did an awesome job, just to reiterate that this is a health issue, not to force anyone to say turn left, turn right. It's more of a health issue. As a healthcare professional, I promise you, I don't want to see anyone else sick, anyone else in the hospital or anything. We have to remember in the city of Detroit, we're only 42.0% vaccinated. What does that mean? We need to keep our mask on. We need to be wherever we can to get vaccinated. And as the city of Detroit Health Department, we have vaccinations all over the city. I'll give you a number, but we have to remember also this Delta variant is surging, not just in the United States, it's surging all over the world. And getting vaccinated is helping prevent severe illness. As the doctor mentioned earlier, hospitalization is preventing death. So all of this is important when you're talking about getting vaccinated, because we know the Delta variant is hitting more people. As you can look at the picture here, this is the original COVID strain 1 or 2. The Delta variant is hitting twice as many. So it's important, if we don't want to go past where we were earlier and lose a lot of people and see a lot of people in the hospital, it's important to get vaccinated. Who is eligible? Well, what's an example of being immunocompromised? I heard the doctor and some questions about this earlier. So the third dose is for those that are immunocompromised. Immunocompromised means cancer treatments, like the doctor mentioned, autoimmune diseases like lupus, Crohn's disease, advanced or untreated HIV. But the most important thing, as the doctor mentioned, talk to your primary care physician. You can call the nurse's line and ask me, but your doctor has an overall picture of what you look like if you're immunocompromised. A diabetic with high blood pressure can call me and ask me, am I immunocompromised? Frankly, I don't want to answer that because you can be, but those things don't say that you are. But I don't know what your white blood count was. I don't know all your medications. I'm going to suggest from the Detroit Health Department, call your primary care physician. Boosters, we'll talk about that a little bit after September 20th, after FDA says, yes, that's a possibility. Looking at data, it's a possibility. But as of right now, only those that are immunocompromised can be giving vaccines, the third dose, at the TCF, and you can schedule that at 313-230-0505. Everyone 12 years and up is eligible. And hopefully we'll have something soon about the younger ones. I know they're talking about vaccinating them before the fall. We're almost there. We'll make sure we're here and present and tell the younger people, go get a vaccine when it's available. Again, we're going to everyone's home. We got plenty of sites. We're going in the schools, educating the children. We definitely are with the CDC on recommending those that are pregnant to get vaccinated. Data suggests, because we've seen so many pregnant women that have gone on ventilation, and they have delivered babies that have also gone on ventilations. If you're pregnant, CDC recommends vaccinations. This is just a picture of our sites. We can talk about this, but I really want to answer your questions, and we want to encourage from the Detroit Health Department. If you're not sure, you're feeling sick or something, go get tested and stay away from others just in case. It might just be an allergy, it might be a common cold. But just to protect you, your family, and those around you, we have a testing site. You can go and get tested. We might as well make sure instead of guessing. That's the only way we can do it. To properly wear a mask is very important. We've seen so many different variants of wearing a mask. Over your nose, all of this should be covered. From the bridge of your nose to under your chin. There's no other way for us to be safe without wearing those masks. I just want to say one more thing. to request a copy of your COVID vaccination immunization card. You can call the vaccination clinic from the Detroit Health Department at 313-876-4667. The option for those is going to be option number 2, and then 2 again. We have a lot of people misplacing their cards. There are no replacement cards, but you can get a copy of your vaccinations, which also include COVID, from the Detroit Health Department with that number. Again, thank you. And if you have any questions, I'm going to stop sharing my screen right now. And
Great. Well, we have questions. Of course, we have questions for you. We always have questions.
yeah.
And I think you kind of alluded to it, but I just wanted to kind of get a little more in depth in our limited time here. You know, if you are exposed,
Yeah.
what should you do after, you know, we get tested? What do you do after you get tested?
So it's
While
going to
you're waiting.
go right. Thank you for that question. The most important thing to remember, if you're feeling sick, stay home. Go get tested, but then we have to remember to go back to isolation. What we used before, that stops. Isolation and quarantining. That stops the spread. If you're sick, having symptoms, that's the only way. If you keep going out and you're not feeling good, it's just going to keep going on.
Okay. So if you have symptoms, quarantine, keep yourself at home. All right.
Yeah.
Quick, I've got 2 more questions for you. One, are you still continuing to host community coordination meetings to provide updates to specific communities? And if so, where can we find information about that?
The information, yes, we are always available for education, for outreach, for vaccination. DetroitMI.gov. If you request a vaccination event, you can put on there education and vaccination team to come out. We go to businesses, to churches, anywhere in the city of Detroit. We are available. I tell families we can do Zoom calls or whatever. It doesn't matter. We want to come and educate and give the right information.
Okay. And last question here, Dr. Colbert kind of alluded to a potential announcement tomorrow from Wayne County. If that in fact happens, if something happens, is that effective for Detroit, or do we have to wait for Detroit to have their own announcement?
I'm going to say for that, I'm going to let Detroit announce that.
Okay.
Our
So
Mayor Duggan, and Chief Officer Denise Fair are in charge of that. And I'm following them.
Got it. So I'll take you off the hook here. So essentially, Wayne County would have an announcement, and then in order for it to be effective in Detroit, Detroit would have an announcement, and you're going to let the right people make that announcement. Understood. Yeah. Very helpful. Thank you so much for being here again today, and we look forward to seeing you again. Thanks for all your hard work.
Thank you. Thank you.
Great. All right. As we bring ourselves to the close of another town hall, a few announcements. One of our partners who's been involved with the COVID313 town halls for the past year and a half, Congress of Communities, and I'll say they've been more than just involved, they've been a driving force behind it. They're in the running for a grant from State Farm Neighborhood Assist Program. They plan to use these funds to increase their youth programming. Please follow the link in the chat to vote for them. The more votes they get, the more likely they are to win, the more likely they are to win these funds to help support youth in the community. Congress of Communities, this is important, is the only Detroit organization in the running for this grant. So please share it widely. We want to see something come back to our Detroit children. The contest ends tomorrow, so please vote for today and tomorrow. On September 8th, we will have a back to school event, and we'll have some more information about that coming up. It'll be from 6 to 8 p.m. My teammates, anyone on the call have any announcements to make? Okay, this brings us to the end of our program, and we look forward to seeing you again. If you need to get vaccinated, please visit the health department's site, and please do so. Please heed what we heard from our experts today. And we look forward to seeing you the next time. So if I can ask all of my teammates to please turn on their cameras, because as you know, this does not happen without a tremendous amount of support from the folks behind the scenes. Please, all of us, let's stay together, let's stay strong, let's stay powerful, and we'll see you again soon. Thank you.